Start.
Thank you, sir. Respected chairperson. I think I had a similar presentation yesterday. So I think you have to make it 6. Already you made 5. Excuse me?
Yes.
6 minutes.
No. 5 minutes, 59 seconds.
Okay, fine. I'll try to finish. This is my financial disclosure. I am consultant to Carl Zeiss India. So what are the common complication can happen with smile? I think no surgery without complication. So these are the 4 common complication can happen. One is suction loss, black spots on the cornea, folded lenticule and lenticule on the flap. So this is the most tense complication anybody can feel, especially when you have got a excess fluid in the conjunctival sac. Here you can see suddenly there is suction loss. So if you have suction loss, need not have to become panic. If the suction loss during the lenticule cut, you can convert into femtolasic. If the suction loss during all the other stages, side cut, cap cut or incision, immediately you can do the recentration of the suction. Then clear the bubbles from the center of the cornea, wipe under surface of the contact lens. Then immediately redock, the machine will start treating. So how to avoid it? This is very, very important. Make the patient comfortable. Most of us, I think, started giving alprazolam just before the 1 or 2 hours before the surgery. Keep talking to the patient when you're docking. And you have, before the surgery, you have to keep telling what are the do's and do nots before the treatment. And one more very important thing, choose the right size cone for the particular patient according to the corneal diameter. So most of us, I think in Indian, we all started taking only small size cone. The one more important suggestion, keep the fornices dry and the cornea moist during the treatment. So this is the one more complication, there is black spots in the cornea after the treatment. See, when machine starting only with the lenticule cut, you can see a lot of dark spots there down near the incision. Once the lenticule cut, it's do the side cut, now it's doing the cap cut, but the dark spots are still there near the incision. So once this can happen, what went wrong, how to avoid it? As I was telling before, keep the fornices dry and cornea moist. Always dry corneal surface is the risk factor for this dark spots. If you have a dark spot, normally beginners find very difficult to dissect. And always when you have to prevent, you have to remove all the debris which is collected under the treatment cone, remove the debris even from the corneal surface. One more important clue I am telling, those are beginners wants to start smile surgery, do not apply the cone over the cornea more than 80 to 90% when you are taking a smaller size cone, because otherwise you may land in some problem. Most of the time if you apply it around 100%, then it might induce the corneal folds. Then this is the one more complication I am just showing. So it starts with the perfect lenticule cut, side cut, then cap cut, then with the incision. So I have trained more than around 40 doctors in and around the world. So the initially normally when they are very much anxious, immediately they go in the once their superficial plane dissection is over, they want to finish the case fast. Once they are inside the posterior plane, when they are doing the dissection, if you do only one side, then the chances of lenticle fold. There you can see the lenticle fold. In such cases, you can go with the micro forceps. Don't try to pull towards the wound. Rather, even you can use the McPherson forceps. Go and hold the lenticule. Then try to do something how you are doing the reverse rhexis. If you do like this, I think lenticule come out very easily without any trouble. So I am showing you one more case scenario where lenticule on the flap and how to manage. After the treatment, normally identifying the proper plane is very important. To start with the anterior plane or superficial plane, then the posterior plane. After identifying, when you want to continue the dissection, some of the time you suddenly go inside the posterior plane. So when you are doing the posterior plane, initially you will not make out. Now when you want to trying to search this plane, you are not getting the plane. This time also I tell all my students not to become panic. You turn the dissector with the small end of the dissector, try to sketch the underneath the cap. Now this lenticule has been open. then go with the simple micro forceps or even with the McPherson forceps. Try to peel away from the wound. How you do? Like as I said that reverse rhexis. So once again, how to avoid? Always before continuing your dissection, identifying the right plane is the key. So in summary, understanding the finer details of the smile procedure is key to make your patient smile. Thank you.